Molly. She's a junior at Duke University, she's 20 years old, and she enjoys art, singing, playing soccer, and Duke basketball. Molly has also been recently diagnosed with obsessive-compulsive disorder, more commonly known as OCD. OCD is an anxiety disorder characterized by both intrusive, obsessive thoughts and accompanying compulsive behavior. Molly's case of OCD is characterized by her obsession with symmetry and order, which causes her to constantly count, rearrange, and organize her things. She experiences extreme anxiety if she feels her room is not organized and symmetrical. Many of Molly's compulsions take up a considerable amount of time. For example, she is often late to class because of her need to check and recheck that her door is locked. She is also extremely careful not to step on any cracks in the floor, and if she does not enter a room the right way, she is sure to redo her actions. Additionally, Molly has a constant fear of germs and contamination. She feels that all doorknobs are contaminated, and thus she must sanitize any doorknob she touches, particularly in the bathroom. Molly is typically found in the bathroom from 30 to 100 times in one day, sanitizing the sinks, scrubbing, washing, and drying her hands until they are cracked and dry. Other common symptoms of OCD include obsessions with forbidden thoughts and actions, wherein some patients with OCD can equate forbidden thoughts with the actions themselves. This is referred to as thought-action fusion, where thinking about an action is just as wrong as actually carrying out that action. Additionally, hoarding is another common symptom subtype of OCD. Some patients have been known to save trash items for decades, thinking that one day they might desperately need that item. Potential causes of OCD include a general genetic or biological predisposition and life events to trigger this predisposition. It has been speculated that early experiences, such as early exposure to religious fundamentalism, can lead those with a biological predisposition to develop OCD to have increasingly obsessive thoughts about unacceptable behaviors, particularly during teenage years. OCD is found to be more common in adult females than adult males, and its median onset age is 19, with the range starting from childhood to well into the 30s. An important aspect of OCD is that those who are diagnosed with the disorder recognize that their thoughts and behaviors are sometimes illogical. However, this does not stop their thoughts and behaviors. They must carry out their compulsive behaviors in order to relieve their obsessive thoughts. Unfortunately, these behaviors only temporarily relieve the anxiety. Many of us experience intrusive, disturbing thoughts, but Molly's thoughts are sometimes extremely distressing and essentially take over her thought processes and disrupt her daily functioning. Molly has considered taking a selective serotonin reuptake inhibitor, also known as an SSRI, in the form of Zoloft, but she ultimately decided to try the more demanding route, cognitive behavioral therapy. Cognitive behavioral therapy, or CBT, especially in the form of exposure and ritual prevention therapy, or ERP, has been found to be highly effective in the treatment of OCD. Patients are encouraged to both face feared thoughts and situations, also known as obsessions, and to avoid the ritualistic behaviors or compulsions that accompany these obsessions. A 2011 study found that patient adherence to exposure and response-controlled therapy was key in overall success in the reduction of OCD symptoms. There have been no significant findings that combining CBT with medication adds any benefits. Luckily, in Molly's case, simple CBT in the form of ERP helped her to lead a significantly more functional life with OCD. However, in the most extreme cases, where a patient has responded to neither medication nor CBT, psychosurgery may be warranted. Psychosurgery, such as a cingulotomy, are only used in the most extreme of cases.